Stream is live. I think we are live, so we can start with the session. Yeah. A very good evening to all the students who are listening to this session. It is my privilege to invite you all to this session. I am Dr. Sandeep Sharma. I am pediatric faculty at DocTutorials, and I have the privilege to invite Dr. Gayathri with us. So, my dear friends, one thing we learned from India-Pakistan war is the truth must come out, and if you don't say it out, nobody else will. So I'm going to put it straight. I'm from PGI, ma'am is from AIMS Delhi. So two people from Central Institutes, two people who are passionate, two people who are part of the team which are passionate are here to talk with you, to discuss with you about final year preparation. I'm a pediatrician, so I'll talk about pediatrics, and ma'am is a pediatrician, so ma'am will talk about ObGyn. So first of all, I congratulate and I invite ma'am to this interview, to this session. Ma'am, welcome.
Thank you so much, sir. So as sir rightly described, this session is basically about how to approach your fifth year as a final year, how to approach that in a way which is smart, focused, as well as future oriented for your PG preparation as well. I know at this point of time, you are juggling a lot of things. You are thinking about what to read, from where to read, how to manage the clinics at the same time, and at the same time, whether to start the PG preparation at this point now. Maybe you're someone who is just starting this journey, or maybe you're midway. I hope this session will help you to understand how to move forward and get you that much closer towards your dream seat in your first attempt itself. So, first of all, this, as you know, now is your final year. You have all these major subjects as it. This is the time where you have to definitely build your concepts. That should be your aim. It should not be just mugging up the things or rapidly reading and just like last minute read. You're keeping it for the end. Don't do that. At this point of time, you have to read, as well as either you can watch the videos, go through the text, or read the text, integrate with the videos as well, so as to complete your preparation, understand the concepts. And in this final year, you have so many subjects from the basic years as well, which you can integrate with. For example, when you are learning preeclampsia from gynecology, you can just integrate with pathology, as well as maybe magnesium sulfate from pharmacology. This integrated approach will really help you not only to cover those subjects, but at the same time, nowadays the questions that are coming is more of an integrated clinical type of questions that definitely will help you for the exam. And I would say many a times I do see students sometimes bunking on the clinical posting as such. Maybe to say 1 or 2 hours as such, so as to read or maybe practice MCQ at that time. But I would really tell you to spend your time well in the wards. Libraries make doctors, but the wards are a place where great doctors become. So you have to definitely interact with the patients, talk to the patient, examine the patient, present the cases. This will not only give you confidence as such. There are so many questions now which is coming in an integrated way. Like for example, when we take gynae itself, when you're posted in the labor room, if you're seeing instrumental vaginal delivery, on that same day, just read upon that instrumental vaginal delivery. Suppose you're seeing a patient who has come to you with eclampsia, just see monitoring of eclampsia, how it is done, when do you stop the magnesium sulfate, the antidote of all these things are actually which is asked further on for your exams, theory exam as well as for the MCQ exams as well. Similarly, sir can also say about the resuscitation, sir. So important is the labor room posting as well. Even in pediatrics, there are so many integrated things that do come, na, sir? I think students
Absolutely.
should
Yes, please.
Please, sir, please. I like to hear about your input, sir.
No, basically, what ma'am is saying is, if you are in final year or if you are in MBBS, it is very important for you to evolve with time. And right now we are in that phase where the exams are becoming clinical and where the exams are becoming integrated. I'll give you an example. If many of you might be in final year, many of you might be in MBBS right now listening to this session, and many of you might be interns or post-interns. If you look at the past papers, let me take you back to 2014, 2015. Questions used to be asked. All of the following are features of congenital rubella syndrome except. So if you remember the triad, you can rule out the option and reach the correct answer. Now the questions which are coming, if you look at INI CT, I'll be very specific. INI CT May 22, the question was, all of the following statements are true about congenital CMV except. Now, if you look at the options, 2 options are from pediatrics and 2 options are from obstetrics gynecology. So one question is talking about perimetrical calcification, one option talking about 𝐾𝐓-𝐒𝐀𝐓, one option talking about what is primary CMV and what is, reactivation of CMV, and another talking about a risk percentage in different trimesters of pregnancy. So you understand, you cannot solve this question if you have not done pediatrics and OBG both, the topic from both the areas. This is what integration is. And if you are very good in one subject, you are not that good in another subject, you will face a lot of difficulty. If you are okay in every subject, you'll have a fighting chance. If you are good in every subject, we are not saying be brilliant in every subject, nobody can, but if you are good in every subject, you have a very good chance, whether it is NEET PG or it is INICET. And it is important that you evolve with time. Don't just randomly solve things, don't just randomly read, and start integrating. And that is what we at DocTutorials are trying to inculcate as well. Ma'am, I have a question for you.
Yes.
Obstetrics gynecology is a big subject. See, let me be honest. Uh, I have a complaint against MBBS students. Everyone reads medicine a lot, surgery a lot, gynae a lot. Nobody reads pediatrics, but it is something I have learned to live with. When it comes to obs gynae, I personally feel it is a very scoring subject. In fact, it is more scoring compared to medicine and surgery. Ma'am, your views on this and why OBG should not be neglected in final year? Ma'am, over to you.
Definitely, sir. There are nearly so many questions, nearly up to 30 questions do come from obs and gyn, minimum I'm saying, and those questions are very easily scoreable, especially if there is a student who have properly attended the wards, the labor room. Majority of the questions are not based just on theory, sir, like on the raw learning. They are integrating and asking so many clinical questions as such, which is so easily solvable by, I would say, more of the clinical experience. So definitely this is the year where you have to build the concepts, where you have to see what is happening around you in the wards, in the labor room. So many such questions are, just for example, just attend the labor room. You are seeing how the labor is getting monitored, or how the labor is, each stage of labor is monitored, and what are the steps that are taken, what are the induction agents that they do, or how is the bishop score being calculated initially. And even during the time of labor, you see how the active management of third stage of labor is being done. At the same time, once you see something like that, just read upon it on the same. If you study the same thing that day itself, or maybe you connect with it rather than just sitting with the book, this will really help you to retain that information for a long time, and you will understand in a much better way as well. So whenever you have these postings, rather than taking up some other subjects, I would say just be with the subjects, try to understand it thoroughly, try to build your concept, and at the same time, if you have some additional time, practice MCQs early as well. The early bird catches the fish, definitely. So you have to start solving the questions right now. Even in my preparation, what I did was I started solving MCQs and doing the questions and early itself. By the time of final year, it's fourth year, final year itself, have started doing that INI. At that time, it was called as AIMS exam. So I had nearly covered that 5-year AIMS questions, which are coming gradually. I won't say just sit with all the questions together. Maybe 10 questions per day, even that is good. You see, in 1 month, you are covering nearly 300 questions. If you just take 10 questions per day. So start small, that's okay. But anything, if you see one scenario, when you solve the question simultaneously, you understand where the important key areas are, you know which are your weakness as well, and many a times you are able to integrate with other subjects also. So attend your clinics, never bunk that, understand what is happening. At the same time, connect with the books, you read in the same setting for better retention. And if you get some time, devote some time for practicing MCQs as well. So I think that will be a good approach for you to understand, and this will really give you a great edge over the others as well, and take you much closer towards that exam.
Excellent advice, ma'am. So if I have to summarize in one sentence what ma'am said, do not neglect your postings. Second sentence, please read while you are in final year, or maybe if you are in intern, if you're posted in ObGyn, read during that time, because what you see and what you read, you will always remember. I'm a pediatrician. I sometimes get into conflicts with my obstetrics, faculty, obstetrics colleagues. But at the end of the day, I have an immense respect for them. Two reasons. Number one, Only when they bring a child into this world, I get my patient. Number two, obstetrics, to be honest, it's a tough field. But at the same time, if you are targeting competitive exam, it's a very, very scoring area. And if you read pediatrics with ObGyn, about 25 to 30 questions from OBG and about 15 questions from pediatrics, 45. I am telling you, if you are a above average to good student, you can score about 37 to 40 correct out of these 45, 46 questions. I'm not joking. People who are good, people who get top ranks. See, medicine is like an ocean. You cannot solve more than 70% questions in medicine, whatever scholar you might be. You have to score heavily in the areas which are frequently asked, and obstetrics, pediatrics, pathology. These are the areas where you need to score heavily. Ma'am, I have another question for you. Uh, Two scenarios. Number one, I am a resident. I'm an intern, currently posted, currently doing internship in OBG. What should be my approach? Number two, I'm in final year or pre-final year doing my maternity posting. What should be my approach to OBG? How should I plan it out?
I would say, especially if you're a final year student who has been posted obs-and-gynae, if you are posted maybe in the obstetric ward, you have to take majority of the cases with you. You'll see so many important cases right there in the ward itself. At the same time, you take a proper history, you examine the patient on the same day. I'm just taking an example. If you have seen a case of GDM, on the same day, you see how the patient was screened, what management is being done, what is the exact diagnosis. Always ask these questions. What is being done? Why is it being done? And what will I do next? Ask this to yourself and try to find the right answer from your books, from your teachers who are there. Never ignore the teachers who are there itself. Always try to learn from the clinics, from the seniors who is there. At the same time, go back to your room, read on that topic, see how it was managed and what is given in the text, compare, and then you will have a more kind of integrated approach as such, and you will retain it much better. Rather than just mugging up from the notes, I would say, you always see the patient, read the same thing. This will help you for much better retention in the long term. So especially utilize your ops posting and mainly the labor room posting. It's so important. Now so many questions are coming which is labor related. All the labor related scenarios, you see this eclampsia being managed there, you see this labor management, you see the postpartum PPH management. All these things are very frequently asked for the further exams as well. So definitely you have to utilize that labor room posting. It's so important. Even suppose you are seeing that there is a patient who's being monitored with CPG. You just ask your senior or you just see what is a normal CPG, what are the tracings that you get in CPG, what are the different decelerations that is there. So always try to learn in the same setting and in the same day if possible. And I would say if time allows, maybe 5 to 10 questions on that as well. That will complete your approach. Maybe if you're not able to do the questions, don't worry. At least see the patient, read on that. Maybe in the question, that part, maybe that is better you can do in the internship as well. So if you're an intern who's there, I would say at that point of time, always you're seeing a case, directly go to the MCQ solving part or the video-based discussion which is there on that, related to the NEET PG content as such, which will help you really to understand that scenario better and to solve that MCQ questions. For final years, always stress upon the theory exam. You also have the theory exam. So I would say don't mark both the things in a single book. Like you have an MCQ kind of preparation ready with you. In the same way, in the same place, you are marking all your essays, you are marking all your PYQs. The notes might look a bit jumbled. You might not be able to figure it out properly. So whichever essay topics, we have a bank of questions from which essays are often repeated. Those questions maybe you can mark out in the textbook, and your MCQ kinds of notes, you can just mark the important PYQs, the probable questions that will come. So always keep it separate, I would say, rather than everything being mixed up in a single book, because finally it will be difficult.
Excellent advice, ma'am. I hope people are listening to it. And for those who are in final year, pre-final year, or those who are doing internship, please save this video, listen to what ma'am said. Ma'am has given very useful suggestions. You might think, see, most of the things myself and ma'am are saying, most of you already know. But what happens is somebody else says the same thing what we are thinking. It helps to reinforce the thing. So don't just think, don't just know about the thing, just reinforce them, just apply them in your day-to-day thing, and you will. Someone just asked me in the comment section, What should be my approach as a final year student to crack NEET PG with a top 1K rank and INI-CT with a top 100 rank in first attempt with internship? Dear doctor, let me tell you very honestly, getting a top 100 or top 200 rank, there is 98% hard work and smart work and 2% luck. Even if that 2% is missing, you can't get that 100, 200 rank. At the same time, to reach into that top 2000 or 1000, your entire hard work and smart work is good enough. If you are doing MBBS right now, my advice is don't neglect your college. It's a common mistake people do. कि हम सिर्फ app पढ़ेंगे, we will only read from the apps and we will get selected. No, you're tomorrow going to be a doctor. You're tomorrow going to treat the patients. Read, attend your clinics, attend your classes, whatever subject you are reading, whatever posting you are you're attending right now, try to read that subject. Aim should be very simple. By the time my final year exam comes, I should be through with 70% of medicine, 70% of surgery, 70% of ObGyn, and 60 to 70%. I'm taking one step back, but 60 to 70% of pediatrics and a reasonable level of important fractures in orthopedics. Even if you don't do the first year, second year, third year subjects, even if you're not thorough with the short subjects, if you do it honestly, read the topic, solve the MCQs. If you have an app, if you have DocTutorials, even greater, because at DocTutorials we have live lectures, we give you what you need. So if you have attended those lectures, just revise them. If you do it, trust me, you are on your way to getting that top 1000 or 500 rank. Now, what rank you eventually get will depend upon what you do and how you revise those neglected subjects in internship. That we will discuss in a separate session, but just focus on final year, attend your clinics, do not neglect your clinics, and whatever branch you are posted in, whatever department you are posted in, try to read the maximum you can in the time given to you. At the same time, knowing about the enemy is equally important as fighting the enemy. So many of you might not have an idea how the exam has evolved in NEET PG. So for those who are targeting NEET PG 26 and 27, Vinod, can I have the slide, please? NEET PG 2026. We have prepared a slide for you. Don't worry, I'll not bore you beyond a point. What is the roadmap to success? This roadmap to success is equally applicable whether you are NEET PG 26 aspirant or NEET PG 27 aspirant. For 28 people, again, rules will be the same. Obviously, it will evolve according to the paper pattern. So, how NEET PG has evolved over the years, understanding the current NEET PG pattern, we are going to talk about what you need to do, what is your preparation plan and strategy, and how we can help at DocTutorials. So, right now, the NEET PG exam which is held, there are two slots, morning and evening, with different question papers. There will be obviously difference in the difficulty level across the two papers. After you have appeared in the exam, there will be normalization to compare the scores, and integrated questions mean, yes, there is a subject-wise weightage, but the exact weightage cannot be known. I'll give you an example. There was an MCQ where they said, a child is having fever, not responding to beta-lactams. He has a black scar and he has thrombocytopenia. What is the drug of choice? Beautiful question. You have pediatrics, you have pharmacology, and you have microbiology coming in. Fever not responding to beta-lactam means atypical bacteria. Black scar along with thrombocytopenia indicates rickets cell infection. So microbiology. Pediatrics tells you that the diagnosis is rickettsial infection, likely scrub typhus. Pharmacology tells you doxycycline is drug of choice. If you are not good in one of the three subjects, you are gone in the MCQ. But if you are okay and you have understood conceptually, this is the way questions are being asked in NEET PG. So your older way of, this subject has maximum weightage, I will read only this subject. This subject has less weightage, I will read less of this subject. Those days are gone. The earlier you understand, the better it is. It is better to learn from the mistakes of your seniors than to make the mistake yourself. So this is understanding the NEET PG pattern. For cracking NEET PG, you need in-depth conceptual understanding, which can be done only during MBBS. Clinical knowledge only during clinical posting. Regular assessment and revision, it will continue throughout your MBBS and in the internship. And then mentorship and guidance. This is where we at DocTutorials come into play. So we are here at May 25. You have to build your conceptual strength, start doing MCQ practice in about a month or so. By the time you are in February 26, you should finish majority of the subject. Even if you feel that don't remember anything, MCQ practice has to continue till you give the exam. And revision cycle has to start from February 26. So start working on that. And GTs and subject-wise tests should start somewhere in the mid from somewhere around August or September of 2025. This is the tentative list. You can always modify it according to where you are standing right now. And we at DocTutorials are always available to you. If you are building your conceptual strength, we have live classes for all 19 subjects with colored workbook. For revision, we have QRP 5.0 with high impact training. We have India's only faculty created Q bank. Let me put it very clear. There is no Q bank in the country which is faculty created. And let me put it very clearly, all the Q banks except DocTutorials are inferior. If you are reading something, you are doing an inferior thing, because no Q bank has been created by faculty except DocTutorials. Once they do it, then of course it becomes a level field. So if you are not doing Q bank of DocTutorials, my dear friends, you're losing out something. Up to you. You want to do the second best thing or you want to do the best thing. And then you obviously have the mentorship. Mentorship means we will be there once you join DocTutorials. We'll be there to help you out, whatever preparation glitches you have in your preparation. These are the samples of DocTutorial workbook. You get these workbooks, you listen to the lecture, you fill it in. So you're writing in your own handwriting and you're remembering the thing. This is surgery workbook. This is ObGyn workbook ma'am has created. So we have taken a lot of effort in creating these workbooks. This is pediatrics workbook. Photographs, we label it, we tell you what is the meaning and how MCQs can be asked. So this is the most interactive learning. When you have a recorded lecture, it's needed, but end of the day, you feel you have the lecture. But what makes you click in the exam is whether you have understood the concept or not. And this is our eminent faculty team. Again, DocTutorials QMank is the best. Our faculty team is the best. I have my friends across various platforms. With due respect to them, this is the best team that you have. You can have superstars in 1 or 2 or 3 subjects, but what clicks for the team which wins the World Cup in cricket is the one which plays together and which has people suited for every role. This is the faculty team that we have at DocTutorials. We have Rajiv Dhawan sir. Sir has been teaching ENT longer than you have been born. We have Rajesh Kaushal sir. We have Nilesh Raj sir. We have Raja Mahindran sir, our surgery faculty. These people have been teaching before you have been born into this world. So they have ages and ages of experience. Then we have the young people. We have Gayathri ma'am. Ma'am is right now, you can listen to ma'am, right? Ma'am is a AIMS product. Then we have Dr. Rahul Rajiv sir. Sir is DM Neurology. Sir is an expert in medicine. And we have Khalil sir. We have Rajsi ma'am. We have Shivani Jan ma'am. We have Pallavi ma'am. We have Jay Prakash sir, JP sir. JP sir teaches FMT in a way nobody can even imagine. Only when you hear, you know about it. Sonu sir, Swati ma'am, Vandana Puri ma'am. Vandana Puri ma'am is let me tell you, if you are targeting INICT and you're not reading pathology from Vandana Puri ma'am, you are losing a rank in INICT. So this is the faculty team that we have created. So my dear friends, we are giving you the best that you can. And NEET PG online live Powerpack is available. Batches are starting from April. You can always consider. We have QRP 5.0 if you want to revise and compact things together. That is available. And new batches are starting in May and June 25. So this is how we at DocTutorials are evolving according to the paper pattern and helping you out. So you might be thinking, sir, DocTutorials ka promotion kar rahe hain. If you know me, many of you know me already. If you know me, I never say something if I'm not 100% sure. DocTutorials is your best bet. If you feel you are a super student, you are already prepared, then any coaching you join, or even if you don't take coaching, you are absolutely ready to take the exam. But if you feel that something is missing, join DocTutorials. We are evolving as the NEET PG exam is evolving. Over to ma'am. Ma'am, OBS versus gynae. Where to pay more focus according to the exam pattern, or should we give equal weightage to the board? This is a controversy every people is asking, and every faculty has a different take. Ma'am, your take on this?
So slightly now more questions are coming from obstetrics as compared to gynecology, sir. But at the same time, you should never ignore gynecology. There are definitive areas from where you can definitely score. Like for cancers, always there is a question on cervical cancer. As amenorrhea is a must-know topic, especially when you take this INI exams. Vaginitis is a definite pakka question that definitely comes in. So I would say don't ignore both, but I would still say that slightly more integrated clinical type of questions are coming from obstetrics, especially from the labor part. It will be like 60-40 kind of scenario, but still don't ignore both of that. Rather than going into 100% of one subject, it's always better if you are a master of 80 to 90% all the subjects. That is going to fetch you the mark. Rather than just being a master of just one subject, focus on all the subjects as such. And one problem that students often have in the final year is we go into that perfectionist mentality. We often feel that we want that full thing. If everything is covered in obs and gyn, at that point only I'll start solving the question. At that point, once I cover all 19 subjects, that is a point of time when I'll start giving the GTs. I would say you have to keep that mentality aside. Start small, it's okay. Even if you learned a bit, if you get time, even if you're unable to solve all the questions which is there, at the same time, whatever is possible, maybe this 10 question, 20 question, 30 question, whatever is possible, simultaneously do that. Like in my final year also, any lectures I could attend in between, I used to go and hear that. Maybe it won't be everything. If I'm taking like pediatrics, it might not be from A to Z of pediatrics, but in between I hear something, I'll just note it down. Always, whenever you are reading something, always make a note that you should be able to revise it again. There is no point of hearing or reading something which you are unable to revise. There is no point at all. So whenever you do that, make a note of it in your notes or somewhere so that you'll be able to revise again. But don't like focus on that perfectionism. It might not happen. Really, it's not possible for you to cover maybe all 19 subjects or anything by the time of final year. But whatever is possible, all those things will definitely add up. I can say it from my experience itself. I cleared the INI exam just after my internship. So whatever MCQs I could solve in between in the internship during the MBBS time, all those things definitely paid off. And you are at this point in the privilege that from your home itself, you can hear the live lectures which is there. We have all these live pack which is there. So whichever subjects is possible, hear on the same day. If time is short, maybe you can hear it in another day as well. So plan in such a way that at least 50 to 70% of the live sessions you are able to cover. The more the better, definitely. But maybe not 100%. It's not possible in final year. So whatever is possible, you do that. And then again, after that, you can go into, if you've covered everything, then you can just go to the QRP, or we have this QRP 5.0 as well as HIT, which is really effective among the students, which will help you to rapidly revise them before the exams as well.
Excellent advice, ma'am. All those who are listening to this, ma'am has been there, done that. Ma'am has cracked INICET. Ma'am is an alumnus of 𝐃𝐓-𝐒𝐀 Delhi. So ma'am knows how the system works. So please note down, after this video goes up on the YouTube session, you can listen to it again and note down the points ma'am is suggesting. Very important thing which ma'am has emphasized is, do not try to do everything. You can't do everything. You can't revise everything. Eat what you can digest. Read what you can revise. Reading, 200 hours or 250 hours of OBG. You feel you are doing great. My dear friends, it's a path to disaster. Let me put it very clearly. I was talking to ma'am before the session started. I said, ma'am, normally I'm very, gentle with my words in my online sessions, but this time I'm going to be very, very crude and very, very, to the point. If you are doing 250, 300, 350 hours of OBG, you are going to disaster, because my dear friends, you are appearing in NEET PG or INICET exam. You have 19 subjects to do. If you are doing something which is clinically oriented, revising it better, doing it multiple times, you have a better chance of cracking the exam in first course. So be smart. You are not there to do PhD or MS in ObGyn. You are there to crack the NEET PG. It is a mistake most people make. They will keep reading OBG, keep reading medicine, keep reading pathology, keep reading pharmacology 4 months. What about the other 18 subjects? So be smart. Give time according to weightage. Maximum weightage should be given to medicine, surgery, OBG. Then you have the other subjects. You have PSM, you have pharmacology, you have pathology, then you have the anatomy, physio, biochem, along with pediatrics, microbiology, and maybe physiology. And then you have the other subjects. And finally, you have the short subject. You leave any subject, you are going into disaster. You do dermatology as well as medicine, you are going to disaster. So be smart. And this is where the help of mentors come into play. Suppose you are preparing for the exam and you get stuck somewhere and you need someone to call, you need someone to help. Once you join DocTutorials, we all 19 of us at DocTutorials are available to you. Our number will be shared with you. You'll be added to the WhatsApp group. You can obviously, if you give a call at 2 a.m., I'm not going to pick up. Neither is ma'am going to pick up. But if you drop a message at 2 a.m., I get up at 7. I'll give you a reply at 7. So you'll have a genuine reply to your query, which might not have been answered somewhere. It is a small thing, but if you get stuck somewhere, it is a big thing. It might make a difference between you getting into AIIMS versus you not getting into AIIMS. Small thing. So think about it. At the same time, for many of you who might see, let us be honest. We are right now in our 20s. I'm not in my 20s, but most of you are in your 20s. So you are currently dependent on your parents, and you might have taken a program already. You want to join DocTutorials. What to do? Yes, we have a special program called as DT-SAT program. Can you please put up the slides, please? We have a special program available for all of you. Few more days to go. I just want to DT-SAT, please put up the program. Yes. So this is the program. We have India's biggest NEET PG scholarship program coming up for you. If you are serious about preparing for NEET PG or INI-CET, at DocTutorials free of cost. 1st June, 9 a.m. to 9 p.m., we have a MCQ-based test. You take this test, 50 MCQs in 40 minutes, MCQs taken from various aspects of the subjects you have done in MBBS. Results will be announced. For the top 100 rankers, 100% scholarship on NEET PG Live Powerpack and all NEET PG plan. Absolutely free. Nobody gives anything free in this world, but you are getting top 100 rankers, 100% scholarship. So whatever platform you have joined so far, if you feel that you will benefit from it, please take this test. Best case scenario, you get 100% scholarship, come into it. Worst case scenario, you see where you are standing right now. Free का जहर भी नहीं छोड़ना चाहिए. ये तो scholarship plan है. Rank 101 to 500 get 50% scholarships, and rank 501 above get 30% scholarships. What it means is any pack of DocTutorials if you want to join. What I'm saying is, let me tone down things a bit and talk in a very honest manner. You're following a X platform or a Y platform or a M platform or a P platform or a D platform. Continue doing it. But if you feel a particular subject, a particular area is weak, or you're not happy with it, take this program, take this test. You get scholarship, join the program, and trust me, that is going to be the best decision that you will take. There will be just few more days to go. You can scan the scanner. In case you have any doubts, you can always put up in the group. You can reach out to any of us. It's free of cost. Take this test. See where you are standing. If you are a serious aspirant, you get scholarship, join DocTutorials. We are there to hold your hand. You don't want to take this program, your dad has a lot of money, absolutely fine with us. But at DocTutorials, keeping jokes apart, we are here in this for our passion. So we are there to help you out. At the same time, joining DocTutorials will not do wonders to your preparation. End of the day, we can only guide you. It is your preparation that you are supposed to do. Let's not take it a bit too far. Coming to my subject, pediatrics is a neglected subject. Those who are in pre-final or final year, I'll give you very simple advice. Attend your bots, read ObGyn, stay away from any other textbook, including Nelson. For clinics, read only Meherban Singh, stay away from any other textbook. If you are a scholar student, you can go for Aruchami Lakshmana Swami. Apart from them, any other textbook, if you have, throw it away or take a pic or hide it somewhere. It is not needed. first 7 chapters of 𝐾𝐓 except chapter number 1, and university exam questions, as well as topics like IMNCI guideline of diarrhea, pneumonia, cystic fibrosis, 10 or 12 topics. I will post the list in this video itself after the session goes up on the YouTube. Go through them. You are doing fine because nobody reads pediatrics so much. Even I did not read pediatrics so much. So you don't need to overdo it. Whatever you need to prepare for PG entrance, we at DocTutorials are there to help you out. Ma'am, over to you. Image-based questions are being asked. Scenario questions are being asked. How to tackle those? Any suggestions from your end if someone is in final year or internship?
Scenario-based questions, now majority of the clinical scenarios as such are very much easily solvable. It's not that tough. If you have attended the clinical postings, it is easy. Like nowadays, so many questions are coming on preeclampsia, severe preeclampsia, the management. What they ask is what you actually see in the wards itself. What's the most important thing that you're going to do to prevent that eclampsia from starting? You are going to obviously administer magnesium sulfate. So many questions are coming on this magnesium sulfate, how to administer them, how will you monitor. All those things are even very important clinically. Such type of easily solvable clinical questions, provided you attend the wards properly, you are managing the patients properly, you read that properly, then you can definitely solve those questions. Image-based questions, again, we'll also provide you a list of images which are high yield and very important. At the same time, majority of the things, what they ask are more of a clinical oriented. There will be a long stem question as such, but it is pretty much easily solvable with the right clinical approach. It's not very tough, sir, as such, if the clinics are strong. I would really suggest that in final year, many times we have this tendency, we sometimes focus too much on the PG preparation and we try to bunk the clinics or maybe skip the clinics. That's a tendency that I often see, especially in the interns or maybe sometimes in the final year as such. Stay away from that. You have to definitely attend that. At the same time, study. Or maybe if you get extra time in the evening, then you can go for the MCQ practice. So don't completely ignore your clinics. That is the foundation. It's very, very important.
Absolutely, ma'am. I think most of you have got an idea. Where do you stand? I'll just summarize it a bit. If you are in final year, pre-final year, attend your clinics. Read what you can digest. Read what you can revise. Build your concepts. Start solving a bit of MCQs. Don't just go for one-liners. There is no shortcut here. In case you feel DocTutorials can help, and I'm quite sure DocTutorials can definitely help, join us. If you feel that you want any exam and your dad has 1 crore rupees he can give you to crack any exam, joining DocTutorial is a option for you. In case you feel that you want to get into the top ranks, you feel that you are being left behind, if you feel that everyone, see, you need to understand, if everyone is doing the same thing, how would it make the difference? If you understand the concepts better, you start early, that is where the difference will come. You are faltering somewhere, someone holds your hand, that is where the difference will happen. At DocTutorials, we will do that. We promise to do that, not just me, but all of us. And we have, I'm from BGI, ma'am is from AIMS. Dr. Vandana Puri, ma'am, she's our pathology faculty. Ma'am is MD from Lady Harding Medical College, and ma'am is a DM from AIMS. Rajiv Dhawan, sir, he's the, he's the granddaddy. He doesn't look like that, but he's the granddaddy of every preparation person right now in the country right now. And we have Raja Mindran, sir. If you are from South India, you know who Raja Mindran sir is. If you are from North India or from East India, sir is the OG of surgery. And many other people. If I'm not taking other names, doesn't mean they are lesser. What it means is we have a very passionate team. So if you feel that your preparation is lacking and you're losing that focus, you can always consider joining DocTutorials. But end of the day, it's not a magic wand. Eventually, you have to prepare and you have to give your best shot. OBG ma'am is saying, attend your clinics, read OBG what you can revise, and try to solve some MCQs in the meanwhile. And what you read in the day, what you see in the day, whatever, difficult labor you see in the day, read in the evening. That's the best way to read. What you see and what you read in the evening, you'll never forget. Do it for pediatrics, do it for medicine, do it for surgery. First year, second year subjects, you will get time in internship. Don't try to read anatomy or physiology in final year. I'm putting it very clearly with all due respect to my first year, faculty members. for anatomy physio, you will get time. Don't read anat physio biochem in final year of MBBS. You will get time for that. These 5 or 6 subjects, the 4 major subjects and 2 or 3 other subjects, if you can add, just try to do them the best you can. And end of the day, these are our opinion. Let me be humble and say, I may be wrong, ma'am may be wrong, we all may be wrong, but what we are trying to do is based upon our experience. And if you feel DocTutorials can benefit you, please take the free scholarship test, which is there on 1st June. And even if you don't take it, you want to join somewhere, you're most welcome to post the comments here. We are always there to help you out, because end of the day, it's not about business, it's about guiding people correctly. That is the philosophy at DocTutorials, all 19 of us as well as our management abide by. So thank you so much, ma'am. Ma'am is a practicing obstetrician and ma'am is very busy, but ma'am took out time to join us. And right now, I've blurred the image a bit. Right now, I'm standing on the roadside. My car broke down on the way, so I had come somewhere. So I decided, let me take it here only. Now my car has been repaired, by the way. I'm sitting in another car, but taking the interview. So we'll be there to hold your hand. We'll be there to help you out. So all the best. And if you're in final year, remember the goal why you became a doctor, not to crack PG entrance, to become a better doctor, to treat patients. So read, prepare. Don't just fall prey to these mnemonics and shortcuts. Shortcut works only in a small way. Surya Kumar Yadav plays reverse scoop only in T20. If he plays it in a test match, he will lose his wicket. We are in a test match. NEET PG INICT is a test match. Remember that. Thank you so much for your time. And thank you so much, ma'am. Really, really happy that you could take out time for us and for the students.
I'm really happy to attend, sir.
Thank you so much. Thank you.
Yeah, we told a lot about studies, how to do, but at the same time, take care of yourself emotionally, mentally, physically as well. Yes, understand this is not a sprint, this is a marathon. So take care of yourself at the same time.
It's a marathon, it's a test match of cricket. Ma'am is athlete, I am a cricket fan. Virat Kohli is resigned. Rohit Sharma has resigned. We have resigned. I have resigned. I am no longer a player. You people are the players. You are the Shubman Gills and the Yashasvi Jaiswals of the coming generation. Play well. Play smartly. Best wishes for everyone. Thank you, ma'am.
Thank you.